In this video, I'm going to be inserting an NG tube into an adult patient. So here I am providing my doctor's orders, identifying the patient. I am performing hand hygiene. And I'm verifying my patient's vital signs, specifically the pulse oximeter, and it is within a good range. I'm explaining the procedure to the client or my patient, and they completely understand. I am putting on my non-sterile gloves. And then I'm going to start by measuring the tube, starting from the nose to the ear and then down to the mid-umbilicus. And I'm going to mark this or keep this number in mind as I'm inserting the NG tube to make sure I'm in the approximate location that I want to be in. So here I'm just showing my marking. And I already assessed the nares for patency and they look good. And now I'm going to be applying the lubricant to the tip of my NG tube to assist with the insertion. And I'm going to start entering it into the nose. Some patients you can give them a cup of water and have them sip as you advance it to help make sure it goes down their throat and not through their mouth or come out through their mouth. So I would do that with this patient as long as they didn't have any issues or trouble swallowing fluids. So I'm still advancing it. As I'm doing this, I'm making sure that their airway is not compromised. Some signs would be like coughing or just, respiratory distress. And this patient is not experiencing that, so I'm going to continue. And I'm going to keep advancing until I get the measured area that I showed earlier. And I have checked the back of the mouth, and I can see that the tube is not coiled in the mouth anywhere. I'm injecting air, and I'm confirming placement with my stethoscope, and I'm going to remove that same air that I put in. Most hospital protocols require that you verify with an x-ray, so I was just doing this to confirm for the time being until the x-ray is done. Now I'm gonna secure it with tape onto their nose, and some hospitals use something called a bridle, which goes through their nose to secure it even more, but right now we're just using tape. I'm also going to mark the date and time on the tape so the next person or the next nurse knows when it was placed or when it was last assessed. I'm going to continue setting up. Also, I'll connect it to suction depending on what the doctor has ordered, low, intermittent, or continuous suction. And then I'm going to secure the end of the tube to the gown. And now I'm ensuring that the patient is comfortable. They are fine. Everything was successful. I'm going to place the bed in the lowest position. Give the patient the call light. And I'm going to start the procedure. This next portion is the irrigation of the NG tube. So I showed you the irrigating syringe. Now I'm attaching it, and there's a towel there just in case there's any drainage or fluid coming out. I'm going to inject the saline slowly as I'm showing, and I'm also going to withdraw the solution as well. And then also obtain the gastric secretions or solutions and I'm going to make those numbers noted in my mind, so when I chart I can all put this into my notes. And then I'm going to reconnect my NG tube to suction and ensure that it's at the correct rate, dispose of my gloves, wash my hands, and now I'm going to chart in the patient's chart.